could indicate a vertebral fracture, shown here. Now, just generally getting shorter as you get old, but not hunching over, is because the cartilage discs between the vertebrae tend to shrink. Fragility fracture. This is breaking a bone from a height less than standing. Say, I reach down to pick something up, lose my balance, catch myself, and break my wrist. Normally, the bone should be able to take that much stress. If it can't, that indicates that they've been weakened. They can also do scans to detect your bone density. Risk factors for osteoporosis. If you haven't run across this yet in nursing classes, a risk factor is a condition that makes you more likely to get the disorder we're talking about. Okay? It's not what this disorder puts you at risk of, it's what puts you at risk of this disorder. So, things that could make you more likely to get osteoporosis. Age, can't really do anything about that. It's just the more time you've been alive, the more time there's been to remove trabeculae in the bones. Smoking, because it's bad for the circulation, can result in less bone deposition. Poor diet, so especially the calcium and the vitamin D. Lack of exercise, if you haven't been putting weight on your bones, then you haven't built them up as much. There's also genetic factors, another one you can't really do anything about. The younger you start, making sure that you've got enough calcium and vitamin D in your diet, you get weight-bearing exercise, and don't smoke, the stronger your bones are going to be as you get older, and the more room you'll have to lose bone before it turns into osteoporosis. Questions on bone loss? We'll just take a brief look at skeletal organization to finish up, and then all of these specific bones we're doing in lab. The two major divisions are the axial and appendicular skeleton. Axial means it's along the axis or center. So that's your skull and spinal column, plus the thoracic cage, which is ribs and sternum, and something called the hyoid bone, which is part of your voice box. It's not really attached to the rest of the skeleton, but it's a bone. Appendicular skeleton is your limbs, plus the bones that attach them to the axial skeleton. So not just everything in your trunk is axial, because your hips are in your trunk, your shoulder blades and collarbones, which after today's lab you're not going to be able to call that again. You'll have to call them scapula and clavicle. Okay. Those attach your arms to your thoracic cage. Your hips attach your legs to your spine, so those are considered appendicular even though they're in the trunk. For lecture, the only thing I'll ask you to know is which bones are in each division. Axial is the skull. You've got the cranial bones that protect the brain, and then the facial bones. We did those last week. You've got the vertebral column or spine, thoracic cage, which is ribs and sternum, and the hyoid. Appendicular skeleton. The pectoral girdle is what attaches the arms, and that's your scapula and clavicle. And then your upper limb bone are humerus, radius, ulna, and bones of the hand. Pelvic girdle is your hips, and then lower limb you've got femur, patella, tibia, fibula, and the foot bones. This illustrates axial skeleton in red, appendicular in yellow, with limbs. surface features are something that we're going to learn specific parts of in the bones in lab. They can be classified as projections, bumps that stick out, usually for attachment of a muscle or a ligament, articular surfaces, places where the bones meet, and openings, holes through the bones, usually for nerves or blood vessels to get through. Sorry we're going over our usual lunch break, but we'll start lab late to make up for it. This illustrates a couple of examples. We can refer back to this for examples as we go through the types. So, projections. A crest is a long ridge. Where do the hot bone? Such as along here. You can feel that on your sides. A process is a bump that sticks out. That one or this one. A spine is a pointed bump, so this one we actually call a spine. And the vertebrae have spines or spinous processes on them. Trochanter is a big rough bump. We only use that name for two bumps on the femur. We have tuberosities and tubercles that are smaller rough bumps like these on the humerus, one on the rib, and so on. And although tuberosity and tubercle are described differently, when you look at the ones on the bones, it's not always obvious which one it's supposed to be. Sometimes the tuberosity, these are both tubercles, and this one's kind of compact. You can see where the whole thing is. I don't have the radius to show you the one that's called a tuberosity. So you got three T's, crest, process, and spine, that are all bumps. Articular surfaces. A head is round. Head of the femur is really obvious. The humerus, upper arm bone, also has a head. A neck connects the head to the rest of the bone. That's easy to see on the femur. A condyle is a rounded surface that's not completely round like this. Okay, so a head is circular. A condyle is usually more oval, like the occipital condyles. Facet is a flat articular surface. There's facets on some of the ribs. A fossa is an indentation. Now, sometimes a fossa has another purpose, but the things we're going to learn that are called a fossa are all articular surfaces. Like we had the mandibular fossa on the temporal bone, is where the mandible fits. There's a fossa on the humerus, where the ulna, your elbow bone, is going to fit. Openings. We've seen foramen. We're only learning a couple of big foramen. There's a whole bunch of little ones in the skull as well. Fissure is a hole that looks torn, like in the back of the eye socket. Meatus is the opening of a canal, a longer tube inside a bone. So the reason this is an external acoustic meatus instead of a foramen is you can't just see right through it. It goes into the bone, and then you have ear structures in there. And then a sinus is a chamber inside a bone. usually just has a tiny opening. We talked about those last week. I can't show them on the model, so like the frontal sinus. All right. So that's all you need to know for lecture.